Assalamu alaikum. I'm Fatima Ali, third year medical student at Mosul University. Today's our seminar is about chronic obstructive pulmonary disease, COPD, supervised by Dr.Zahraa Marwan. COPD, a persistent airflow limitation that is usually progressive and associated with an enhancing chronic inflammatory response in the airway and the lung to noxious particles or gas. COPD include emphysema, chronic bronchitis, asthma, bronchiectasis. Emphysema: abnormal permanent enlargement of the airspace distal to the terminal bronchiole, accompanied by destruction of the wall without obvious fibrosis. Emphysema causes dilatation of the airspace by destruction of the alveolar wall, leading to collapse of alveoli during expiration. Classification: Type of emphysema: central-acinar, para-acinar, paraseptal or distal-acinar, mixed, any classification, or irregular. Central-acinar emphysema, central-alveolar, proximal acinar. Dilatation of the respiratory bronchiole, upper lobes severely involvement can cause it with chronic bronchitis, invariably occur in smokers, coal mine worker, carbon and dust. Pana-acinar emphysema, whole acinus uniformly affected, lower lobes severely involvement associated with alpha-1 antitrypsin deficiency, cigarette smokers. Paraseptal emphysema or distal acinar, localized along peripheral part of the acinus, predisposing to spontaneous pneumothorax, adjacent to focal fibrosis, less common. Mixed irregular emphysema, most common, less significant, common around scar tissue, combination of type. Symptom of emphysema: difficulty breathing, shortness of breath, wheezing, coughing, chest tightness, morning headache, weight loss, fatigue, difficulty sleeping, difficult concentrating. What causes emphysema? Main cause of emphysema is cigarette smoking. If a person were to smoke for large amount of time, they are most likely to get emphysema. Another cause of emphysema is called alpha-1 antitrypsin deficiency. Alpha-1 is a genetic disorder when there is lack of enzyme in the lung to protect it. A person could also pathogenesis. Smoking or air pollution on genetic predisposing can cause oxidative stress, increasing apoptosis and synostosis, inflammatory cell release of inflammatory mediator, protease-antiprotease imbalance. Also, congenital alpha-1 antitrypsin deficiency can cause protease-antiprotease imbalance, and all of this cause alveolar wall destruction. Morphology: thinning and destruction of alveolar wall with advanced disease adjacent to alveolar great large airspace. Terminal and respiratory bronchiole may be deformed. With the loss of elastic tissue, alveoli tend to collapse during expiration. The number of alveolar capillary diminished. Diagnosis: pulmonary function test, high-resolution compound tomography, chest X-ray, arterial blood gas analysis, sputum examination. And thank you.
Assalamu alaikum. I'm Noor Mohammed. I will explain the second part of the chronic obstruction pulmonary disease, that called the chronic bronchitis. The definition of this disease: presented productive cough for at least 3 months in at least 2 consecutive years without any identifiable causes. A condition of chronic or recurrent cough associated with the mucus secretion in the bronchi and bronchioles, which is not due to the lung disease. The cough may occur in the certain season. Damage to airway caused mainly by the chemical sources, like cigarette smoke, industrial gases, motor vehicles exist. The causes of chronic bronchitis: main causes is cigarette smoking, second-hand smoke, inhaled irritants such as smoke, industrial pollutant and solvent, viral and bacterial infection, and also underlying disease processes such as asthma and cystic fibrosis. The pathogenesis of chronic bronchitis: increased size of a mucous gland in the wall of the bronchial tree, increased size of viscous mucus, which may result obstruction of the bronchial tree, edema and increase in the cellular infiltration airway walls, narrowing of the respiratory airways, continuous irritation by smoke, SO2 or infection, hyperplasia and hypertrophy in the mucous gland. These lead to the airway obstruction and lead to the emphysema. This picture shows the normal bronchi and the bronchi with chronic bronchitis. In the morphology of chronic bronchitis, we can see enlargement of the mucus secretion gland, increased number of goblet cells, loss of ciliated epithelium cell, squamous metaplasia, dysplastic change, and bronchogenetic carcinoma, inflammation, fibrosis, and resulting narrowing of bronchioles, coexistent emphysema. Now, this picture shows the cross section of the lung with chronic bronchitis. As we see, there is a hyperemia, swelling, and edema of the mucous membrane, frequently accompanied by the extensive mucoperylene secretion. Sometimes we can see heavy cast of secretion and pus fill the bronchi and bronchiole. Microscopically, the characteristic histological features are chronic inflammation of the airway, predominantly lymphocyte, and enlargement of the mucus secretion gland of the trachea and bronchi. Now, the symptoms of this disease are heavy cough, sputum production, wheezing, shortness of breath. Other symptoms: fatigue, sore throat, and nasal congestion. When exacerbation of chronic bronchitis occurred, we can see severe coughing with chest pain, cyanosis, and fever. We can diagnose the chronic bronchitis by the chest X-ray, sputum, that means mucus coughed up from the lung, to be tested on underlying presence of bacteria, pulmonary function test, check of the sign of asthma or emphysema by measuring how well you are able to breathe, and finally CT scan, that means high-resolution X-ray from the body from various angles. The risk factors of the disease are a weakened immunity system, smoking, chronic obstructive pulmonary disease, and repeated exposure to the lung irritate. Finally, the complications of the chronic bronchitis are pulmonary hypertension, cardiac failure, respiratory failure, and recurrent infection. Thank you for listening. Now I let my colleague to explain the third part.
السلام عليكم ورحمة الله وبركاته. الطالبة طيبة سعد حامد، المرحلة الثالثة جروب دي. موضوعنا الكرونيك obstructive pulmonary disease. راح أتناول جزء من عنده اللي هو أسما. Asthma is a common long-term inflammatory disease of the airway of the lung. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily target bronchospasm. Symptoms include episode of the wheezing, cough, chest tightness, and shortness of breath. عندنا هنا صورة توضح الأسمة ولا bronchoconstriction. normal bronchial tube normal، وهنا نشوف بالinflamed bronchial tube during attack asthma نشوفها thick عكس النورمال. Pathogenesis of the asthma: antigen representation by dendritic cell with the lymphoma cyst and cytokines response leading to airway inflammation. And asthma symptoms: some of the principal cells identified in the airway inflammation includes mast cell, eosinophil, epithelium cell, macrophage, and activity T lymphoma cyst. هنا نشوف المورفولوجي مال الأسمة، نشوف inflammation, eosinophil, gland hyperplasia, mucus, plaque in the lumen, وhypertrophy in the muscle layer. هنا نشوف cut section of the hyperinflated lung of a patient dining asthmatic appearance essential normal. The disease is concentric as an inflammatory disease in the airway leading to airway hyperresponsive obstruction, mucus hyperproduction, and airway in the wall remodeling. Asthma is the classical recurrence as the typical Th2 disease with increased IgE level and eosinophilic inflammation in the airway. هنا حنشوف مخطط للباثوجينيسيس أسمى: antigen وتي ليمفوما cyst، interleukin 12 positive وانترلوكين 12 السالب حينطيني interleukin 4 interleukin 30 interleukin 9 interleukin 4 interleukin 3 وانترلوكين 5. بالتالي حنحصل بيزوفيل ايزينيوفيل ماست سيل، بالتالي حيصير عندنا ميدياتور انفلاميشن، هيستامين بروستوغلاندين، بالتالي يصير برونكايل هايبر ريسبونسيف ايروير اوبستراكشن، بالتالي تطلع الاسما symptoms. asthma causes: نشوف infection like sinusitis, cold, and the flu. Allergens such as the pollens, mold, bed-tender, and dust mites. Air pollution, topic smoke, exercise, cold, change in the weather, change in the temperature, or humidity. Strong emotion and ataxia carrying stress. Medication such as aspirin. هنا عندنا صورة توضح السيمتومز اللي حتطلع على البيشن. كل صورة وتوضح السيمتومز الخاص بيها. عندنا هنا shortness of breath, difficult breathness, dry cough, night cough, wheezing, chest pain. دائما تكون السعال جاف ويطلع وقت الليل. Thank you for listening.
Assalamu alaikum. I'm Hawraa Raheem. I will explain the last part of chronic obstructive pulmonary disease that called bronchiectasis. The definition of this disease: abnormal permanent dilation of airways due to a destructive necrotizing infection of bronchi and bronchiole. The causes of this disease: congenital or hereditary, cystic fibrosis, Cartner syndrome, pulmonary sequestration, necrotizing infection, bronchial obstruction, tumor, foreign body. Other chronic inflammatory status: rheumatoid arthritis, graft-versus-host disease, allergic bronchopulmonary aspergillosis, idiopathic, 25 to 50% of cases. The pathogenesis: obstruction due to tumor, foreign body, insulated mucus caused resorption of air distal to obstruction, atelectasis and accumulation of intraluminal secretion, non-obstructive bronchiectasis is due to pneumonia, and atelectasis which increase negative intrapleural pressure, which exert an external force of bronchial walls, causing them to dilate, usually left side, affecting lower lobes. In the morphology of bronchiectasis, we can see most severe in the peripheral lower lobes, airway dilate up to 4x normal size, mild to necrotizing acute, and chronic inflammatory of larger airways, bronchial fibrosis. Now, the picture shows the cross-section of lung of bronchiectasis, markedly distant, peripheral bronchi, usually in lower lobes, can trace of pleural surface. Bronchial walls are irregularly thickened, gross imaging hosted on other surface. Microscopically, chronic inflammation, ulceration of bronchial wall, ossification of bronchial cartilage, thickened pleura, febrile inflammation, and fibrosis of alveoli. The presentation: productive cough, sputum, fever, hemoptysis, anorexia, and poor weight gain may occur as time passes. Crackles localized to the affected area, wheezing. Finally, the complication: core abdominal, brain abscess, amyloidosis. Thank you for your listening.